introductions. We will have a panel discussion. So I've got some wonderful speakers today for you. And then there is a chance, crucially, for you to ask your questions to us. So that's what we're going to do today. Next one. Was doing this to me earlier. Naughty. Right, so you'll look across the bottom, you'll see some icons. If you want to ask a question, please can you use the Q&A? So it's like a speech bubble with a question mark in it. So if you put your questions in there, you'll also see there is a chat function. That is more if you want to comment or ask for information or tech support. I won't necessarily be looking in there for questions. And just to say that this webinar will be recorded and available on the MSc and DSc YouTube channel. Next. Okay, so introduction. So my name's Clare Owen. I'm a director at the Medical Schools Council, and Medical Schools Council has a relationship with the Dentistry Schools Council, so I'm also working there for them. We have a great panel today. So Zoe Abbas, unfortunately, can't be here with us today, but she has sent a really good video. And then we have Raeesa Qureshi from the University of Leeds and Rachel Greatrix from UCAT. So really knowledgeable panel here today for you. So we're going to do personal statements. What should students write and how do schools use personal statements? We're going to do interviews. So what sort of interviews are there? How should you prepare? And then crucially, we're going to talk about the UCAT. So how do you prepare for that? DSC will share a short survey with you after the webinar to gather your views on how the webinars are running and what you would like to hear about in the future. Please do, if you have time, put in your comments and suggestions because we'd really like to focus these webinars on areas of interest to the audience. So yes, our next webinar is 18th of June, so you can sign up to that. So it's what to do if you don't get an offer. And I will pass over to Raeesa, I think.
Yeah, great. Hi, everyone. Nice to meet you all. So as Claire said earlier, my name is Raeesa. I work for dentistry admissions at the University of Leeds. So with regards to personal statements, it's something that we are still looking at quite closely throughout the whole application process. We do ask that your personal statement is relevant to dentistry, otherwise the application would not be considered, unfortunately. So it has to mention some insight into dentistry, and that's kind of the core thing that we look out for. We don't accept any additional documents or anything in addition to your application or your personal statement. So just ensure that you include everything in there that you can. One of the things that the School of Dentistry really looks at in its selection process is, and we align our selection process according to the NHS 6 Cs. So that's something we'd like you to mention in the personal statement, or at least show that you have some knowledge of it. And we would assess these qualities throughout your personal statement and also at your interview if an applicant is shortlisted. Another thing that we look out for is your motivation to be a dental professional and working in the healthcare field. So knowing what your passion is, why you want to work in dentistry, any experience that you've had related to dentistry. It's not essential that you have work experience in the field, but if you have got any relevant work experience, we definitely ask you to mention that. And alternatively, if you've completed a MOOC, which is a massive online, open online course in dentistry, definitely mention that. It just gives us an example of what you've done so far and what you're aiming towards in the future. Things to avoid, we do ask you to avoid writing a list of things you've done rather than list specific things, we'd like you to maybe highlight some examples and expand on them. So for example, team working, skills that you've observed in just in life, in your work experience, and just tell us how you've demonstrated that you can work as part of a team, for example, and things like that. It could be a sports club that you've been a part of. So we try and keep it we don't want it to be too difficult for you. We'd like you to draw on your skills and your work experience up until school and college and things like that. So if you don't have any, professional work experience, it's not a problem. It's still about how you're using the skills that you have gained up until now and how you reflect on those and how you apply that to working in the healthcare field. So we're also looking for individuals who obviously know how to communicate and how to work with a wide range of people. And again, if you've not done that before, please don't worry. It's just knowing, it's providing evidence of your social and cultural awareness. So maybe think about skills that dental professionals require and how those skills help you to learn about other cultures and groups, especially with those that have protected characteristics and things like that, and how these experiences have actually encouraged you to change the way that you think. So anything that's relevant to working in the healthcare profession would be ideal. And again, we've mentioned work experience and life experience. So drawing on things like, irrespective of where you've come from, whether you've come from school or if you've done anything ever since, we'd like you to identify the kind of life experiences you've had to date and the skills that it's nurtured and things like that. So making us aware of the skills that you think a dental professional would need, and how those skills would be put into place if you're working, and just showing us your commitment and that you're responsible. And also thinking about what would make you a good dental student as well as a professional. So not just working in the field, but actually studying in dentistry. And, it could be things like resilience, your self-awareness, your compassion, and things like that. So qualities that you have that will show us how you stand out as an individual. Other core things that we do look for in a personal statement is if you are requesting a deferral, just let us know why. If you'd like to take a gap year, just let us know why again. Any resits or academic grades that you have or any extracurricular activities that you've achieved. It could be something like an EPQ, anything that you feel that would be relevant to, your application to dentistry and what would make you different to other individuals that are applying. And you can ask your referee to, talk a bit about you and your personal statement if you like, but it's not necessary. We would like them to concentrate on your reference, but if you can, that would also be positive. And finally, I would say just try and remember to draw on all your different experiences, keep the 6 Cs in mind, and just reflect on your life, your examples throughout your education, and anything that you write, just remember to kind of include why we should choose you and anything that sets you aside from other applicants. And that's it, really. Thank you. Sorry, Claire, your mic's on mute.
I'm on mute. Fantastic. Thank you very much. Should we play the video from Zoe now? Now, I have to warn you, this video is very good. It's very professional, but when we played it earlier, it did come up a little bit quiet. So just pop the volume up on whatever device you're listening to, because it does work and it's fantastic, but it just might come through a little bit quiet through the speakers. So let's go.
Hello everyone, I'm going to deliver this presentation on multiple mini interviews, known as MMIs. My name is Zoe Abbas and I am the Head of Admissions at the University of Birmingham. So first of all, what are MMIs? So MMIs are commonly used in interviews for dentistry across the United Kingdom. They consist of a number of small stations which test a range of skills and abilities. The MMIs are useful when recruiting for specific courses and are also widely used in medicine and other healthcare professions. So what do MMIs involve? So I'm going to talk you through the process we have here at the University of Birmingham, and it's likely to be relatively similar in other universities across the United Kingdom. So when our candidates arrive at the dental school, they're given a short presentation by the admissions tutor and ID checks are completed. The candidates are then given a tour of the hospital and taken into the MMIs. The MMIs here at the University of Birmingham are held on clinic, and each station is set up in one of the clinical bays. There will be allocated reading time for candidates to go through instructions prior to entering the bays. The instructions can consist of written instructions, or they can include video instructions. Candidates will be told when to enter each of the clinical bays to complete the tasks which have been set. It's important to note that sometimes a station will have numerous tasks to complete, and they will assess different skills. Do be aware that some stations may appear to test a particular skill, but in fact may be testing something entirely different. Now, on this slide, I've included some past questions from the University of Birmingham. The first question is, if you could travel anywhere in the world, where would you travel to and why? Now, I'd like you all just to think about your first response to this question. So for me right now, it would be to go somewhere really nice and sunny and peaceful. The point of this question is not to see who can bring the topic back to dentistry, but instead we actually want to find out a little bit about you and see whether you can hold a conversation with the interviewer. The second question is, if you were invisible for the day, where would you go and what would you do? So again, with this question, please don't say you would go and do work experience at a dental practice for the day. We want to know what you really would do. So the more honest you are, the better. So for instance, right now I would spend the day reading a really good book completely uninterrupted. So again, the point of these questions is that we want to know a little bit about you and know what interests you outside of dentistry. As you can see, these questions are hard to predict, and each year we ensure our questions are reinvented. So the third question is, do you think the UK government gives enough funding to the NHS? Now, we know this is a complex question, and what we want to find out from this is for you to demonstrate some knowledge of the healthcare system that you will potentially be working in. You do not need to know things like the surfaces of a tooth or the details of what makes a composite filling, but we do want you to have an interest in current topics in the area of the subject that you want to be studying. So the final example question I've put up is, how have you come to these decisions? Now this can apply to multiple tasks and stations, and we want to understand your thought processes. So even if you do not complete a station or a task correctly, we want to know why you did things the way you did and to be able to communicate that with us. So if you had a practical task to complete and didn't manage to complete it correctly in the amount of time allotted, but you talked us through what your thinking was and the way that you're going to problem solve, then you may still be able to mop up a few marks in that area. So what are we assessing? So the MMIs will assess a variety of things that are relevant to the role of a dentist. This may include communication skills, which are of key importance when taking care of patients and working as a part of the wider dental team. We may assess your empathy and your resilience, in addition to your honesty and your ethical reasoning. The reason for this is we want to ensure that our dentists of the future have the morals in keeping with those required in the profession. As a dentist, you are being trusted to look after the needs of your patients, and it's crucial that this duty is respected. We want to know that you understand not just the good bits, but also the drawbacks of the career and the challenges that it can present. Dentistry is a vocational degree, meaning that we train you up to become clinicians, and the set of skills that you graduate with are very specific to dentistry. So it's really important to us that you enjoy your careers, so having an understanding of what the career entails is important. We may assess your problem-solving skills, as in dentistry you're constantly faced with issues that you must work out how to fix. The list that we have put up on the screen here are things that we may assess, but it's by no means limited to this list. But this just gives you a little bit of an idea of the themes that we may be assessing when you come to your MMIs. So a few key tips when going into the process of the MMIs. Try to avoid bringing everything back to teeth. So if a question asks you about you, then please do answer honestly. A common mistake that many candidates make is rehearsing prepared answers and trying to make them fit the question that they are being presented with. We see so many candidates in the space of the interview week that it becomes really obvious when this happens. Now, always remember there are multiple stations in the MMIs, so if one station doesn't go particularly well, then try to put it behind you and move on to the next. And the biggest thing to remember is that you are also seeing whether this is somewhere that you want to study, so it's very much set up to be a two-way process. Try to relax and try to enjoy the process. When you get to the stage of MMIs, you've already achieved so much and should be extremely proud. And the final thing is wishing you all the very best of luck, and I hope you've enjoyed this talk.
I think that was an excellent presentation, actually. Some really good tips there. I really liked the idea that you should not just talk about teeth. I thought that was really good advice, and I can see the temptation to do it if I was in an interview, so it's really good to hear that. Rachel, do you want to bring up your presentation?
Sorry, too many things on my computer. Hello, everyone. My name's Rachel Greatrix. I work for the UCAT consortium. I'm going to give you a bit of an overview for the UCAT test today, cover what the UCAT is and outline how those of you that are teachers and advisors can support your students through their UCAT journey. The information that I'm going to cover today is also on our website. So the UCAT is an admissions test. It's used in selection processes by UK medical and dental schools, and it was developed to help universities achieve greater fairness in selection by helping them make more informed choices from their many highly qualified applicants. Rather than focusing on academic knowledge, the UCAT assesses a range of cognitive skills, attitudes and professional behaviours identified by our universities as important for success as dental and medical students. The UCAT is a multiple choice test. Our candidates sit it on computers at Pearson VUE test centres throughout the UK and internationally, and the test in 2025 takes just under 2 hours long. So our universities use UCAT results alongside other selection criteria such as academic grades and interviews, which we've just heard about, to decide which applicants to make offers to. UCAT results are delivered directly to students' university choices once the UCAS deadline for medicine and dentistry has passed. The universities listed on this slide require the UCAT as part of their entry requirements for dental programmes. There is a full list on our website. If your students are applying for 2026 entry to dentistry, they will need to sit the test in summer 2025 before submitting their UCAS application. There are some of the key dates for your students on this slide. As you can see, the UCAT test window runs primarily over the summer holidays, so we recommend that you try and ensure that your Year 12 students or equivalent in the other countries in the UK, that they need to know fairly immediately if they're going to sit the test in 2025, and this will give them lots of time to help familiarise themselves with everything they need to know and get any support arrangements in place and before they sit the test. As I mentioned before, the students will receive their UCAT results on the day of testing and well in advance of the UCAS application deadline. Your students need to register for the test, and they're able to create accounts now on going through our website, and they will be able to book their tests in a couple of weeks. The UCAT test fee is £70 for tests taken in the UK. You can help your students, support them in this process by making sure they're aware of these key test dates, as they must sit the test within the testing window, and they are only allowed to sit the test once in any test cycle. Every year we have lots of candidates who leave booking their tests until late in the cycle. This doesn't leave them enough time to prepare adequately, and they may well end up having to test at a location at a time which isn't necessarily convenient. So we do recommend our candidates are organised and book and sit their test as early as they can. Candidates entitled to accommodations in exams due to a documented special educational need are usually entitled to access arrangements when sitting the UCAT. They need to get these approved in advance before booking the test, and our website outlines the application process. Similarly, on our website, candidates can apply for a UCAT bursary. This covers the full test fee and are available to UK candidates from low-income backgrounds. There's lots of information on our website about the process and the evidence that candidates are required to provide. In terms of test content, the UCAT consists of 4 subtests: verbal reasoning, decision-making, quantitative reasoning, and our situational judgment test. The UCAT differs from academic exams in that there isn't any subject-specific knowledge. However, candidates probably do need to be familiar with GCSE level math skills, such as fractions, percentages, and ratios. That'll help them save time in the quantitative reasoning subtests. Our candidates are provided with an on-screen calculator and a notebook and pen to help them work through questions. In terms of scores in each of these subtests, our candidates receive a score between 300 and 900. They get a total cognitive test score between 900 and 2,700. And for our test of situational judgment, they receive a band, with band 1 being the highest. Just noted there that abstract reasoning has been withdrawn from the test in 2025, which some candidates may come as a surprise to some, but hopefully most of your candidates are coming new to the test this year. Our question tutorials provide a detailed overview of each of these subtests, and they're available on our website. In terms of preparation, the best way to prepare for the test is using the free resources available on our website. Our highest scoring candidates report spending around 25 to 30 hours on their UCAT preparation and starting around 6 weeks before the test date. We are aware there are lots of commercial training companies offering coaching in the UCAT. We're not affiliated with these companies. We don't endorse what they say, and we can't comment on the quality or accuracy of the information they give. We really advise candidates to be skeptical of the claims that these companies are making. We have several free preparation resources available on our website, including a preparation plan, question tutorials, question banks, and time practice tests. And the questions that we're providing are developed by exactly the same people who developed the questions in the live test. We also have lots of information on our website about what to expect on test day and tips and advice from previous high-scoring candidates. All of our preparations are fully updated for 2025. As I mentioned earlier, results are available for candidates on test day. They get a copy of their score as they leave the test centre. This is also available through their Pearson VUE account. They receive their UCAT result well in advance of the UCAS deadline, so we do urge candidates to pay attention to that result and how universities use the test in selection. This will help inform them about the universities that they're going to be most successful in applying to. So thank you for listening. A few quick takeaways to help students with their UCAT journey. Do check out our advisor resources on the website. Lots of up-to-date information for your students. There's a mailing list on there you can sign up to get more information directly to your inbox. Please do start talking to your students about the UCAT and signposting them to the resources I've mentioned, and help them, once they've got their results, to make those UCAS choices in advance of the UCAS deadline. Similar to the other panellists, wish your students the very best of luck, both with the test and with their future applications. Thanks very much.
Brilliant. Thanks, Rachel. I've got one question straight away from you. What was the score for between 300 and 900? What were you referring to in your presentation? Oh, you're on mute. Yeah.
Each of our cognitive subtests is scored between 300 and 900. Scales, you receive a scale score for each of those subtests between 300 and 900.
And so what does the final score look like?
So it adds up to a score between 900 and 2,700.
Excellent. Okay. Will these PowerPoint slides be available after the meeting? So the PowerPoint slides won't be, but you can watch back the webinar on YouTube. And also, I would say that I know that Rachel, everything that Rachel said on that PowerPoint was available on the is available on the UCAT website. So they do have a lot of advice and guidance there as well. And Rachel also, another Rachel, has put in some really helpful links in the chat. So lots and lots of resources for you to look at. I think if I could say anything, it would be do not pay for a UCAT preparation course. There are loads of materials available on the website. Use them. There's even, Rachel, I believe, a sort of suggested way of revising for it.
Yeah, we provide some I mean, it is a very personal thing, I think, preparing, like, I mean, revising for your A-levels or equivalent is a personal approach, isn't it? But we do provide some structure to candidate preparation, and we have provided a kind of workshop approach, which teachers and advisors can potentially run within their own school if they want to help guide their candidates through preparing for the test. So it kind of guides you through some of these resources I've referred to in a bit of a structured way. So a few activities to send your students off and do on a weekly basis, which should get them towards the point where they're feeling pretty familiar with the test and prepared.
Fantastic. Thanks, Rachel. Got a really good question here, Raeesa. For the MMIs, when it said don't learn the answers, does that mean to not create a script and memorize it rather than you say your answer from your heart? What do you think, Raeesa? Yeah.
Yeah. So with MMIs, specifically at Leeds, I would say we say don't learn the answers because we don't want you to have, a scripted answer that sounds robotic. We want it to kind of be a natural response, something that initially comes to your head as soon as you hear the scenario question or you hear the question. So I mean, it's all fine to have, prepared things that points that you'd like to say or you'd like to cover, definitely. But in terms of memorizing responses, I would say don't memorize, structured responses. Definitely just go with the flow, whatever pops to your head, just making sure that you're covering all bases. And again, in the MMIs, we try not to make it too formal. So just you can always, ask your interviewer to repeat your question, just to give you a bit more time to kind of go over it and see if another word triggers another memory that you've got or another point that you could make. So definitely just go with the flow of things and try not to put too much pressure on yourselves to have a scripted answer.
Yeah, because sometimes you can end up not listening to the actual question and trying to fit in one of the ones that you've remembered.
That's it.
Sort of retrofit it.
Yeah. So, and from previous experience, I know it's been, it's hard when you've got a pre-prepared answer and you're asked a question and the only way you know how to answer it is by saying that answer, and it might not even be relevant to the question. There might be certain things interviewers are looking for. So definitely just still prepare for your interview. Definitely prepare. Just be careful in the way that you do it. Just make sure your structured responses are, structured to the answer and they're tailored in that way.
And I think one of the biggest ways you can prepare, isn't it, is just answering questions from people.
Definitely.
So, just sitting with your parent, a friend, just get them to ask you questions so
Yeah.
that it feels,
Yeah.
so that you're used to thinking in the moment, feel confident about how you're going to communicate, that sort of thing. There's no sort of magic trick to it. I mean, this is the next question: what makes a student stand out in MMIs? But
Yeah.
do you have any reflections on that? It's really about being natural, isn't it?
Definitely 100% being natural. It's evident when a student or an applicant is nervous, and that affects their responses. The more confident you are in what you're saying, that will make you stand out as an individual. The more confident you are in the points that you're making, the way that you're even carrying yourself on. It's hard when it's online, but even the way that you
Yes.
carry yourself on the camera, making eye contact with your camera and the interviewer, just makes small things like that that really do make a difference, rather than just what you're saying. You could be saying all the right things, but you could just be looking down and fidgeting and things like that, and that would have an impact on your kind of outcome of what you're saying and things like that. So yeah, definitely just being confident and assertive, and just knowing how to carry yourself in the interview, and obviously being prepared in terms of what you want to say. So, learning about the profession in itself, life as a dentistry student and things like that would definitely make a difference to your own knowledge and how you prepare for your interview.
Yes, and I'm assuming that dental schools will give a list of things that they look for at MMI. So one of the things you might want to do would be to look through that list and think about the examples that you might give. If someone asked you a question about teamwork or something, you might think, oh, for a teamwork question, I'm probably going to talk about my job that I had at the shoe shop, and how when it was really busy, we all had to help and support each other. So
And I think
sorry,
that's key what you said. Working in a shoe shop, it could be something that's not even related to dentistry, but it's the skills that you learn in that specific role that would help you, apply it to dentistry and becoming a dental student working in healthcare. So yeah, definitely that's a good point.
Yeah, it's about looking at what they're looking for, thinking about your own life, and reflecting on how you might be able to demonstrate those skills. They may come out in different ways. So you may get scenario type questions. Do you do scenario type questions at Leeds?
We do at Leeds. And another thing that I'd like to mention with Leeds is that fingers crossed, if you are shortlisted for an interview, at the point that you've received an interview invitation, we do send out a pre-MMI booklet which has topics that we'll cover, and that will help you prepare for your interview. So it will give you an idea of what kind of areas we'll be looking at and what you'll be tested on. So that's a big part of preparing for your interview. And that's all that I could say about interviews at the moment, really. But yeah, it's definitely useful to have that information. And a lot of information is available on our website as well, including a personal statement guide, how to prepare for interviews, what the selection process is, and things like that. So it does all tie in together.
And you want people to do well, don't you? You understand that it's nerve-wracking, but you want people to do well. It's not a torture process. It's supposed to be
it's supposed to be. We at Leeds, we do try and make it fun. We try to make it as not informal, but as formal as it can be, but without any pressure on the applicant, without any pressure on the interviewer. Even they get nervous a bit when they're speaking to candidates, because they want candidates to do well, and we obviously want the best. Because if you've got to the point of an interview, obviously more than capable, and we'd like to see that in the interview. So we try not to put too much pressure on applicants and give as much information as we can without giving away the questions.
Yeah, absolutely. So please put in some more questions into the Q&A, particularly on UCAT if you've got any. I'm just going to highlight some of the resources that my team have put in the chat here. So the Studying Healthcare website, which is our website that covers medicine, dentistry and pharmacy, has a whole section on preparing for interviews. So there'll be loads of really good resources to look at on there. DSC has a values and attributes document. So if you look on the Studying Healthcare, Why Dentistry, you will see that some of the things that all dental schools are looking for are fleshed out there. So you know, that's the document to have a look at, start to think about how you might be able to demonstrate those. Just start getting ideas in your head as to how you might be able to evidence that from your life. Medical Schools Council has a document on how to run an MMI at your school or college. So if there are teachers and careers advisors here, that resource is available. Now, obviously medicine and dentistry are very different professions. They are not the same thing. Dental schools will be looking for something slightly different, but practice is all about being confident to answer questions. So I still think that having a look at that, if you were applying to dentistry, the MMIs will be fairly similar. They'll be, you know, moving around different stations with different questions on different subjects. That won't change between the two. Some of the emphasis on what the questions are might change between the two. But I still think it would give people a lot of confidence if that was something that you could run for them. And it's a really good resource. So I managed to spin that out for long enough that we got some questions. So I'm going to go for a UCAT one. Where do you find the UCAT score requirement for each university?
Okay, so our universities tend to use the test in slightly different ways depending on their selection processes. So your best starting point is to think about the universities that you might be interested in applying to, and go and have a look on their websites. They will have as part of their selection processes, they will have information about how the UCAT is used in selection. Some universities provide information, for example, around scores that have been, you know, the kind of minimum scores from last year or from previous years, which gives you a sense of how you've performed as well. And also remember on those websites that for some candidates with certain backgrounds, from low-income backgrounds in particular, the universities may have slightly different approaches to their selection criteria. So there was lots of information. So yeah, go and have a dig around, and you should be able to find that, and particularly useful once you've got your result. You're on mute, Claire.
Oh, someone has to do it, everyone. Just to flesh that out a little bit, what's a cutoff score?
So some universities will use the test so they will check that their applicants have all met their minimum academic requirements, and they may then rank their applicants on UCAT score, and therefore have a cutoff score for the number that they want to invite for interview. So if they want to see 300 people for interview, they'll rank their applicants until they've got down to 300 on their UCAT scores, and that will be the minimum score that would mean somebody moves forward for interview. Other universities use the test differently, so they may weigh the UCAT score alongside other parts of your application, or indeed they may look at your whole application holistically and be looking both at, you know, Raeesa mentioned personal statements, so they're not scored, but they're being looked at alongside potentially other parts of the application. So lots of different approaches, which is why once you do have a kind of short list of universities, it is useful to dig down so that you know how the test is going to be used.
There's a really interesting question here, Rachel, and then I will ask someone else something because you've been working quite hard. So the UCAT test has changed this year, hasn't it? So that's going to have implications for previous data that schools might publish on what the cutoff score is, for example.
Yes, it is, and that is a bit of a challenge for all of us this year. For me, it's remembering how many subtests we've got, and Claire asked that question earlier about what the scores range between now, because that's all changed. We have provided some information on our website where we show the previous year's scores as if abstract reasoning didn't exist,
Right.
so that you can get a sense of what you know, the top performing scores would have looked like and what those range of scores look like. I'll put a link to that in the chat.
You see, and you know, Rachel and UCAT do things like that because again, they want to support test takers. They want you to know, you know, how to make a good application using your UCAT score and all of those things. A lot of effort does go in to thinking about the applicant. So, Raeesa,
Yeah.
I've got a question for you.
Oh,
If I get asked something and I have no knowledge or idea on it, can I skip the question?
you can. You can definitely ask to skip the question, or you can say, "Can I come back to that later?" And then maybe at the end, once you've answered, you know, your questions, you can maybe ask the interviewer to repeat it. It might be that by the end, by the time that you get to the end of your response, you might want to go back to it and just think, you know, oh, I want to add something to that question. So definitely, by all means, you can. But we would advise you to maybe say something for any question that you are asked. But if you absolutely feel like you cannot answer it and you feel like you won't answer it to the best of your ability, definitely ask to come back to it later or skip it altogether.
Can I follow up on that one? How
Mhm.
many of your questions have right answers?
I
You know,
can't
how much
say
is
too
it
much
about
about that.
talking? Okay, sorry.
It's just because of you know, the way that we score the questions. So if
Yeah,
I say too much, I don't want to give
fine,
away anything, just in
fine.
case.
Yes, absolutely fine. I'll find my neck in.
We would welcome, no, absolutely fine. We would welcome, you know, anyone to email us if they have any specific kind of questions. That way it's a bit easier for us to have something in writing,
Yeah, sure,
you know,
sure.
just to kind of cover all bases.
No, that's absolutely fair. Now this is very variable, but how long will each station last in for your MMIs?
So for our MMIs, approximately each station lasts about 6 minutes.
That's
Um,
different across dental schools, is it? It's other dental schools have longer or shorter stations, do you think? Or is
I'm not 100% sure about other dental schools.
it's okay?
But yeah, I think I just remember from the last cycle that we did in Feb, they were averaging about 6 minutes, but obviously it depends on how long, you know, an applicant does take to answer the questions, but we have strict timings just to make sure we don't run over. So it's approximately 6 minutes per station.
Fantastic.
Yeah.
Rachel, suggested length of time to practice for UCAT.
Yeah, I've seen that there's a few come in asking different approaches to this. I think, as I commented earlier, I really think that preparation is a very personal thing, and rather than thinking I'm going to spend however many weeks or whatever it is preparing, I think we're at a nice early stage now. It'd be a good time for potential candidates this year to go and have a quick look at what the test looks like, get a sense of what's being covered in each of those sections. Not at this stage start answering questions, but just get a sense of what those questions look like, which sections of the test do I think I'm going to need more preparation on than others. So there are some people will find different sections of the test easier than others, and that will get you start to get you thinking about, well, what does my preparation journey look like to when I've got my test booked. So I think the first thing is to familiarize yourselves. I mean, we would probably say a couple of months should be more than adequate in preparing for the test. And that's on the assumption that you're doing short amounts, you know, now and again. You're not sitting there for 2 months preparing for the test. That really should not be necessary. I mean, one of the key things about the test is its timing. So once you are familiar with what the questions look like, the next stage is, well, you know, this is a time pressured test. Am I going to get through these? What's my strategy to get through each of the subtests? But I think once you're familiar with them, you've got that strategy to get to end of each subtest, then you're kind of almost there in terms of how well prepared you're likely to be for the test. So yeah, give yourself some time so you're not feeling pressured at the end, but certainly you're not talking about kind of solid months of preparation. 6 to 8 weeks, I would have thought, should be fine.
Fantastic. Thank you, Rachel. Raeesa, how do I make my statement stand out without sounding cliche or over rehearsed?
Yeah, so this is quite important. So obviously starting, a subject with, dentistry is something I've always wanted to do. We would maybe ask you to start with a real life experience or a real life moment that you had your first insight into dentistry. It could be, an experience from when you first visited the dentist or when you went with somebody that visited the dentist. It could be your first day in a work experience, kind of week that you've done at the dentistry, a dental practice. So definitely start with that. A lot of applicants tend to start with quotes about dentistry. So something that's a bit more personal, not just your standard, I love dentistry and I've wanted to do it since I was a kid kind of thing. Also reflect on how your personal interests actually align with dentistry. So what dentistry actually involves. So for example, including things like, and this is not to say you need to focus on it, but you can include things like hands-on skills that you've learned, your fine motor skills. It could be making origami, it could be, doing henna and things like that. So anything where you can draw upon similar skills that you've done in your personal life and how that relates to dentistry. And also, this might sound obvious, but mentioning a specific aspect of dentistry that really appeals to you. So it could be, tooth extraction, gum cleaning, it could be anything. Anything that appeals to you directly about dentistry. And lastly, I would say showing your self-awareness, knowing what the profession actually demands from you as a student, as a healthcare professional, and things like that. So that's a good place to start with your application, and hopefully that would, with your statement, sorry, and hopefully that would kind of set the theme for the rest of the statement, hopefully.
Fantastic. Can I ask, do all dental schools use MMI? And if you don't, Rosie may know, and she may be able to put the answer in the chat. So don't worry if you don't know.
I know some do. I'm not sure if all of them do, but a few others I think that I've kind of had experience of just through talking to other applicants have done MMIs before, but I'm not sure if they all do.
Okay. Maybe, Rosie, maybe you could pop in the chat just the answer to that. Rachel, is there a break between stations for the UCAT?
There is, and with some changing in timing for the test this year, we've kind of shifted those a little. So in the standard version of the test, our candidates get a break of 1.5 minutes between subtests, apart from at the start of the quantitative reasoning subtest when there is a 2-minute break, and that's because our candidates will have just finished a longer, lengthier decision-making subtest. So we thought building in a slightly longer break there would be good. But I mean, it's up to candidates around how they use that time. They can just decide, I want to plough on and carry on, or they can sit there and, have a breather, relax, get their head in the right place for the next section, which is probably what we would advise. But it is up to you how you use that time in the live test.
Fantastic, thank you. So I've got one question here. My main reason for dentistry is due to work experience. Do I have to talk about that? Do I have to talk about what actually motivated me to do work experience, or can I just start from the work experience? You're on mute, Raeesa.
Sorry, yeah, so absolutely great question. I would say definitely start from why you chose to do the work experience, and then just go on, what specifically about the work experience has, pushed you to do dentistry. So definitely start with why you chose to do the work experience in the first place. That would be great.
And your feelings on virtual work experience? I've just got another question. They're coming thick and fast today.
Absolutely fine. I mean, obviously during COVID, it was a thing.
Yes.
I'm not sure if people still do it actually, but yeah, any work experience is great, whether you have work experience in a physical practice or online. Either way is fine, as long as you draw something from it and you draw a skill, something that you've learned that you can apply to your, studies, your future career, definitely. Any experience is key. So definitely mention that.
Fantastic. And then this is going to be my last question. Rachel, is September too late for taking the UCAT test?
Definitely not. The vast majority of our candidates take the test in September. I mean, we do recognise that for a lot of people, kind of July, August is too early. They're not necessarily prepared. They may well be on holiday. They'll have better things to do than sitting our test. So September is fine, but you need to remember that by then, for the majority of our candidates, they're back in school. They will have other things to do. So do bear that in mind, because you know, I don't want to ruin anyone's summer holiday and preparing for the test, but you also need to bear in mind there will be other demands on your time once you're back in school. My real advice about this is to try and not leave taking your test until right at the end of our test cycle. If you do that and you're just not having your best day, you're not feeling brilliant, then you will not have very many options to reschedule your test. And you may end up having to travel, maybe taking the test somewhere where you at a time when it is just not convenient. So try not to leave it to the very end, but yeah, September is fine, and hopefully gives you some real flexibility around finding a test slot that suits you.
Suits you, is in a good place, that getting to it's not going to stress you out, all of those types of things. Brilliant. Thank you, Rachel. And just thank you. So many good questions today. I really appreciate that from the participants. It really helps when you are engaged and send in such good questions. Thank you hugely to Rachel and Raeesa for coming along and doing this presentation, and to Zoe for sending in that video, which I thought was great. We are doing this the next one on the 18th of June. But in the meantime, just thank you so much to everybody, and we'll see you soon.